Well, let's say that you're experiencing poor circulation, or maybe you have pain while you're walking. Well, that means you might not be getting the blood flow you need to your legs and arms. Dr. David Burkart of St. Joseph Medical Center is here to tell us about PAD, or peripheral artery disease. So this is something that, I'm finding out is really commonplace for doctors like you to see, but I really hadn't ever heard about it.
Yes, peripheral arterial disease simply means you have blockage or narrowing in the arteries, typically caused by atherosclerotic plaque outside of the heart. So arteries in the neck, the kidneys, and what we normally deal with, the arteries of the legs. If you're over 70, 1 in 4 people will have it. And if you have a diagnosis of peripheral arterial disease, your 5-year mortality, your chance of dying in the next 5 years, is greater than if you were just diagnosed with breast cancer or prostate cancer.
Oh my gosh, that is very alarming. So something that we really need to be tapping into and looking at. What are some of the risk factors where we could see our arteries sort of shrinking?
Well, risk factors include diabetes, high blood pressure or hypertension, smoking. We all know smoking's bad for us. High cholesterol levels, family history, and then the one we always forget to think about, age. People are getting older, people are living longer, so we're seeing a lot more peripheral arterial disease.
Okay, and then what are some of the signs and symptoms where we may know, hey, I should really be going into a doctor and getting checked out?
You may notice that your legs feel tired, more tired than they should. You might have pain in your legs when you walk. You might have numbness. People will talk about their legs feeling or seeming like they feel cool. If things get more severe, you can have ulcers and sores and skin breakdown that just won't heal. And if things get really bad, you might even progress to amputation.
Okay, and then how can this actually complicate your life? I know you've told us a lot about it so far, but why do people need to start paying attention now?
Well, it can complicate your life because you can have severe pain with walking. Let's say some people can only walk 5 or 6 steps before they start having symptoms. So that's lifestyle limiting. And then, like I say, if you have non-healing spots on your feet that won't heal, they can become infected, and then you can get into all sorts of problems if that happens.
Okay, and then what can we actually do if we've got some of the signs or symptoms and we want to take our health into our own hands?
Well, there's an easy way to tell if you have peripheral arterial disease. It's as simple as taking a blood pressure in your arm and in your ankle and comparing the two. If the blood pressure is a lot lower in your legs, that means that you have blockages in the arteries that supply the legs. And they have different tools. You can put a little device on your finger and toes and it can tell you. And they offer free screenings at most hospitals.
Okay, and what can people expect, right? So if there's a free screening that we can get, what should we expect?
Well, at St. Joseph Medical Center, where we do most of our work, they offer Tuesday, Wednesdays, and Thursdays, I believe. You can go in and do like a 5-minute screening where they give you a questionnaire, ask you about common signs and symptoms, take a few pressure measurements, and then they can give you a pretty good idea if you may have the condition. And if you do, then you want to get with your doctor and work on your risk factors, control your cholesterol, your diet, your exercise. And then if you have significant blockages with really bad symptoms, then we can, with a little balloon or a stent or lasers or different tools that we have, open up the blocked areas and then usually take away your symptoms.
Well, Dr. Burkart, thank you so much for telling us, about this and really what we could do to make our health and life better. So you can set up an appointment for a free PAD screening on Tuesdays, Wednesdays, and Thursdays at St. Joseph Medical Center. Just call 816-307-0790, or for more information, go to stjosephkc.com.